If you're researching Medicare and looking for a video that will help you understand the Medicare supplement plans G high deductible and plan F high deductible, this video is for you. So stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs from Hawaii to Virginia and Alaska to the Florida Keys. We are a true independent insurance broker. That means we work with all the major insurance companies and offer all the Medicare supplement plans. Most of all, we represent your best interest, not that of an insurance company, and our services are free to you, the consumer. All you need to do is call or email us for our help. I understand how confusing Medicare can be. I help people with their Medicare decisions every day. My mission and my agency's mission is to help you make an informed decision about your Medicare choices. That is why in this video, I will go over what you need to know if you're researching or considering your Medicare supplement high deductible plan G or the high deductible plan F. So in this video, I'll show you an easy way to understand exactly what the high deductible Medicare supplement plans cover and how they work. At the same time, I've already seen videos and heard other agents mischaracterize the Medicare supplement plan G high deductible benefits, which is a nice way to say that they've described the benefits incorrectly. I will clarify that confusion for you in this video. Then, in this video, we'll also review the pros and the cons, or the strengths and weaknesses of high deductible plans that may be different than other Medicare supplement plans. And finally, we will look at when you should consider a high deductible plan relative or versus another Medicare supplement, and how to tell if you're in part of the country where the high deductible Medicare supplement plans are actually worth considering. Now, there are some parts of the United States where a Medicare supplement high deductible plan is a no-brainer. There are other parts of the country where it's such a poor value relative to your other Medicare supplement plans that it's simply not worth considering in most situations, in most circumstances. So I have a rule of thumb which I apply and I teach my agents to use when quoting the high deductible plan to help determine when it makes sense financially. And I'm going to share that rule of thumb with you in this video. So let's get started. There are two Medicare supplement high deductible plans. There's the Medicare supplement plan F high deductible and a Medicare supplement plan G high deductible. Now, if you were eligible for Medicare, even if you didn't enroll, if you were eligible for Medicare prior to January 1, 2020, you can choose either the plan F high deductible or the plan G high deductible. If you were not eligible for Medicare until January 1, 2020 or later, your only high deductible choice is the plan G high deductible. Despite a common misconception, they both have the exact same benefits and should be the exact same price or within a few pennies. I'll go over that in detail in just a moment. First, with the high deductible plans, like all Medicare supplement plans, you get to keep the benefits of original Medicare. That means you can see any doctor, go to any medical facility in the country, as long as they accept original Medicare. And second, no insurance company has a say in what is or is not covered. Medicare is your primary insurance coverage. The intent of Medicare is to cover everything that's medically necessary, and they rely on your doctor's opinion and your doctor's diagnosis to determine medical necessity. Simple enough. Next, to understand what the Medigap Plan G and the Medigap Plan F high deductible plans cover, the first thing you need to do is erase whatever preconceived notion that you have of the term high deductible. Just erase it. I can assure you the benefits of the Medicare supplement plans, these high deductible plans, will be unlike any of the other high deductible plans that you've experienced in your lifetime. The easiest way to understand the benefits of the Medicare supplement or Medigap Plan G high deductible and Plan F high deductible is to first look at your coverage under original Medicare. Then understand that the role of the Medigap high deductible plans is to provide a maximum annual out-of-pocket expense, a cap on your medical expenses. Now, I've linked below the benefits of a Medicare Part A and Medicare Part B. If you can, please print them out. They're going to look like this. These are the benefits that you have with your red, white, and blue Medicare card if you do nothing. If you just keep your original Medicare and don't trade it in for Medicare Advantage plan or add a Medicare supplement. Just your Medicare Part A and your Medicare Part B. For example, when you see a doctor for outpatient care, you're going to pay a small annual deductible. In 2020, it's $198. So you pay the first $198 in outpatient Medicare bills, after which Medicare pays 80% of your coverage and you pay 20%. If you go into the hospital as an inpatient, your Medicare Part A will only start covering you after you've met the Medicare Part A deductible. Now, this is a per event deductible of $1,408 for the year of 2020. Then you have coverage for a total of 60 consecutive days before having to pay a daily copay. It's 2020 as I make this video, so the numbers you see on the screen here represent the 2020 deductibles and copays of original Medicare. These numbers will change every year, but the concept of how your coverage works with the Medicare supplement high deductible plans and Medicare will not change. When you get a Medicare supplement Plan G high deductible or Plan F high deductible, Medicare Part A and Medicare Part B will be your only insurance coverage up until you reach the amount of the deductible. Once you reach the deductible, you have 100% coverage for the rest of the calendar year. Medicare Part A and Medicare Part B still pay their portion first. For 2020, the Medicare Supplement Plan G high deductible and the Medicare Supplement Plan F high deductible both have a maximum deductible of $2,340. Because Medicare still pays its portion, that $2,340 is really your maximum out-of-pocket for 2020. The deductible for these Medicare supplement plans is really your annual maximum out-of-pocket for the calendar year. In my Medicare Supplement Plans Explained video, I go over your MOOP. MOOP stands for your annual maximum out-of-pocket expense. If you just have Medicare Part A and Medicare Part B as your insurance, you have no MOOP. You have unlimited financial exposure to medical bills. When you purchase a Medicare Supplement High Deductible plan, you create a MOOP equal to the plan's deductible. That means these plans create a maximum out-of-pocket of $2,340 for the year 2020. The entire intent of a Medicare supplement plan is to put a maximum annual out-of-pocket cap on your financial risk for inpatient and outpatient expenses. That is exactly what the Medigap Plan G and Plan F high deductible Medicare supplements do. That annual maximum out-of-pocket cap is equal to the deductible. So the easiest way to understand these Medicare supplement plans is to simply understand that your insurance is original Medicare with a maximum annual cap equal to the Medigap plan's deductible. It's that simple. Your Medigap deductible is your maximum annual out-of-pocket risk. Now, I'm a visual person. That's why I like the idea of printing out these sheets. And if I were sitting next to you, I would place them on a table and have you study them so that you can see exactly what you have for insurance, and then understand that the Medigap Plan G or the Medigap Plan F high deductible simply place a maximum on your financial risk. Now it's time to clear up the confusion about the benefits of the Medicare Supplement Plan G high deductible versus the F high deductible. Then I'm going to go over some of the risks that these supplements and these plans have that other supplements do not. After which I'm going to show you how to evaluate if the high deductible Medicare supplement plan is right for you and the rule of thumb that I use to determine if a high deductible plan should even be considered in your area. So let's clear up the confusion about the Plan G high deductible benefits versus the Plan F high deductible. The Medicare Supplement Plan G high deductible is new. It was introduced officially on January 1, 2020, but even as I make this video in 2020, the Plan G high deductible is not available yet in many areas. Each state has to approve the supplement plan itself and then approve the insurance companies and their applications. The bottom line is very few insurance brokers have experience with this specific plan, and I've seen and heard a lot of the benefits of the Medicare Supplement Plan G explained incorrectly. Most people evaluate the different Medicare supplement plans by looking at the Medicare Supplement Benefit Table. Now, you've probably seen this is actually on the Medicare website. It's also in the Medicare and You guidebook and the Choosing a Medigap Policy publication. Here's the problem. This table, as it refers to the high deductible plans, has been dummied down to the point of being incorrect or misleading. When we look at the reference to the high deductible plans, it reads, Plan F and G also offer a high deductible plan in some states. With this option, you must pay for your Medicare covered costs, coinsurance and copays and deductibles up to the deductible amount of $2,340 in 2020 before your plan pays anything. And then it notes that Plan C and F won't be available to people who are newly eligible for Medicare on or after January 1, 2020. This leads most readers to believe that the Plan G high deductible policy is like the regular Plan G in that there's no coverage for the Medicare Part B deductible, the outpatient deductible. Well, like I said, dummied down to the point of being incorrect. These publications are nice and they're very useful, but they're not official insurance documents. The official insurance documents that you want to refer to is called an outline of coverage, and it's provided by the insurance company offering the Medicare supplement plan. The outline of coverage is an official document that's provided, and it provides a summary of your coverage. Now, you should get an outline of coverage either when you or before you apply for your supplement. Just ask the agent. They should have no problem providing it to you. For this example, I'm going to pull up an outline of coverage from the company that sells almost all of the high deductible Medicare supplement plans in this country. They're certainly the dominant player. Now, I can't give the name without their permission. We don't have time for that, so I'm just going to blur it out. So let's take a look. We have the same benefit table, just stylized a little better. Actually, I kind of like it better. So when we take a look at the notes, the notation for the high deductible plans, it says Plan F and G also have a high deductible option, which requires first paying a plan deductible of $2,340 before the plan begins to pay. Once the plan deductible is met, the plan pays 100% of covered services for the rest of the calendar year. Well, that's the same. In fact, Medicare Supplement Plan G does not cover the Part B deductible, so you would think it would be extra. But then, right here, this is what's missing elsewhere. High deductible Plan G does not cover the Medicare Part B deductible. However, the high deductible plans G and F count your payment of the Medicare Part B deductible towards meeting the plan deductible. Let me repeat that. However, high deductible Plan F and G count your payment of the Medicare Part B deductible towards meeting the plan deductible. When designing the Plan G high deductible, the intent was for it to be just like the Plan F high deductible. In order to get the Plan G high deductible to have the same benefits as the Plan F high deductible, but still follow the macro law of 2014 that indicated that no supplements offered to people new to Medicare as of 2020 can cover the Medicare Part B deductible, they had to get cute with the language. The Plan G high deductible doesn't cover the Part B deductible, but it credits you the money that you spend towards the Part B deductible in meeting your $2,340 MOOP. The Plan G high deductible and the Plan F high deductible offer the exact same benefit. What is relevant to you as their difference is that you can only get the Medicare Supplement Plan F high deductible if you were eligible for Medicare prior to 2020. And actually, if you were eligible for Medicare prior to 2020, you can get either Medicare Supplement Plan F high deductible or Medicare Supplement Plan G high deductible. If you are not eligible for Medicare benefits until 2020 or after, the only high deductible Medicare supplement plan available to you is the Plan G high deductible. They should be the same price or about the same price when offered by the same company. Next, I want to cover the pros and cons of these high deductible plans and my rule of thumb to help you identify if you're in a part of the country where a high deductible Medicare supplement plan makes sense. Now, before we get into this next issue, I'm going to ask you to help me out. If you like the information that I'm sharing with you in this video and you believe that others would too, please press the like button below and comment, share it, leave a question. You may have noticed there are no commercials with this video. We don't generate any revenue by your watching this video. We generate revenue by those who choose to do business with us. When you press the like button and you comment, and comments are important, or you share the video, you tell YouTube that this is a good video worth sharing for others. That helps other people also looking for information on the Medicare high deductible plans to find this video, which then increases our exposure and our business. So please like, comment, and share this video. And if you would like to, give us a call or email. We'd be happy to work with you. All right, back to the video. So what are some of the risks of a high deductible Medicare supplement plan that some of the other Medicare supplement plans don't have? Well, first is the annual deductible, that $2,340 deductible. That's not a fixed amount. It can and will increase over time. In fact, it is linked to your Social Security Cost of Living Index. Now, this link is written into Social Security law. If your Social Security Cost of Living, your COLA, goes up by 2%, then your supplement deductible will also increase by 2%. Now, this has not been a problem since we've not had persistent high inflation since the early 1980s. But still, if you're considering this plan at age 65 and you have another 25 years of life, understand that 25 years is a long period of time for something to compound against you. With the current deductible at $2,340, if there were just a 2% annual inflation, your deductible would be close to $4,000 in your late 80s. At 3% inflation, your deductible would be near $5,000. You get the picture. Suffice it to say, unlike any other Medicare supplement plan, the value of the high deductible plans will decrease during periods of high inflation. If you have an annual premium increasing in addition to the higher deductible, you have two parts of your plan compounding against you. This will leave you paying more each and every year for less insurance. In states that price these plans as attained age, where the price automatically increases a little bit each year as you attain an older age, the annual percentage price increase on a Medicare Medigap high deductible plan is typically higher than the average annual percentage that you may find on a Plan N. As a result, in these states, the value of the high deductible plan relative to your other choices is less and less each year, even in times of relatively low inflation. I'm not suggesting this is a deal breaker, only that as you evaluate these plans relative to your other choices, you keep this in mind. Next is the Murphy's Law of the high deductible. Now, recall that the deductible for these plans and for Medicare itself resets every January 1. It's a calendar year deductible. And that means if you get seriously ill late in the year, let's say October, November, December, and you reach that deductible, so you've paid the deductible, but then you're still sick and you may find yourself still fighting whatever ails you come January 1, and the deductible resets on January 1, right in the middle of your medical battle. As a result, you're going to end up paying that deductible twice because of when you were sick. If you have a high deductible Medicare supplement plan, you must have the resources available to pay at least 2 years deductible. Otherwise, you may have insurance and then still face economic hardship due to medical costs. Or just as bad, forego seeing medical care because paying the deductible twice is a burden. That's not a good thing. If that is the case, you may want to consider one of the other Medicare supplement plans. All right, next subject. What are the benefits of the high deductible Medicare supplement plan relative to your other plans, your other choices? Well, number one on that list is a very low premium. Now, as with all Medicare supplement plans, the premium will change. It's going to be different by where you live, possibly by your age, but the premium is typically less than $100 a month and often closer to $50. A lower premium means that even in the worst of times, it takes less cash outlay, less premium to maintain your Medicare coverage. It also frees up money to build on your coverage, and that's very important. You can have a high deductible Medicare supplement plan plus cancer coverage that will pay you a lump sum tax-free check of $25,000 to $35,000 or more when diagnosed with cancer, and even add dental, vision, and hearing coverage and still save money over most of the other Medicare supplement plans. You can end up with a much broader, more comprehensive health coverage and still have less out of pocket than if you had a higher cost Medicare supplement plan. So think about it. Another benefit is a low maximum annual out-of-pocket risk relative to a Medicare Advantage plan. Now, while you would have more out-of-pocket risk relative to other Medicare supplement plans, the high deductible plan has an annual out-of-pocket exposure that is, well, 1/3 to 1/5 a typical Medicare Advantage plan, plus you keep the benefits of original Medicare. So a typical Medicare Advantage PPO can have a maximum annual out-of-pocket, a MOOP, of $6,700 to $10,000 when you need medical services. The high deductible supplement's currently at $2,340 for the year 2020. So all of that should be considered when you're researching which Medicare supplement plan or which Medicare plan is right for you. So next, let's look at when you should consider a high deductible Medicare supplement plan instead of another supplement plan, plus how to tell if you're in a part of the country where a high deductible Medicare supplement plans are worth considering. And I'm also going to share my rule of thumb for when I consider a high deductible Medicare supplement plan worth looking at and when to recommend it. Medicare supplement premiums are wildly different from state to state as well as from one insurance company to another, even in the same state and region. Now, as I mentioned earlier, there are some parts of the country where the Medicare supplement high deductible Plan G or Plan F are a no-brainer. There are other parts of the country where it's such a poor value relative to your other Medicare supplement choices that it really doesn't make a whole lot of financial sense to consider the high deductible supplement. Now, as you may know, my company helps people with their Medicare choices in every state except Massachusetts. Sorry, Massachusetts. When I consider if a Medicare high deductible plan is or is not a value worth seriously considering or advising, I look into two things. This is my rule of thumb that I use to tell me when is a good time to advise somebody to consider the high deductible plans or not. So you may want to jot this down. When I evaluate the price of a high deductible Medicare supplement plan, I do so relative to the other Medicare supplement plans, mostly the Plan N, but also the Plan G. Because the Plan N is your lowest cost Medicare supplement plan with full coverage. So for a high deductible Medicare supplement to be a good value, the annual premium for full coverage, the Medigap Plan N, should be close to the MOOP of the high deductible plan. And that means the Medicare supplement plan should be at least $165 to $180 a month in premium. Why? Because at that price level, the annual premium for the Medicare supplement Plan N plus deductibles and copays is close to the maximum annual out-of-pocket that you would pay with a high deductible. For example, let's say your Medigap Plan N option is $180 a month. That's $2,160 a year in premiums, even if you never see a doctor. If you do see a doctor, then you're going to pay the Medicare Part B deductible, currently $198, plus copays. Now add these expenses and you're looking at $2,500 out of pocket for the year. Compare that to the high deductible plan where your premium may typically be between $600 and $850 a year, and only in the worst case scenario, maybe once or twice in 10 years, would you have enough medical expenses to reach that maximum $2,340. So the rule of thumb, number one, when your out-of-pocket expenses during the average year of owning a Medigap Plan N is close to the worst case scenario of a high deductible plan, you should at least consider the high deductible plan. So the rule of thumb number one, the annual premium on the lowest cost full coverage alternative, your Plan N, should be close to $2,000 a year. Rule of thumb part two. I prefer a high deductible Medicare supplement plan in either an issue age or community rated state. Some states mandate that all of the Medicare supplement plans offered in those states are priced as either issue age or community rated. Now, we discussed this in detail in the Medicare Supplement Plans Explained video. For this case, understand that in those states, unless you're with the wrong insurance company, price increases are few and far between. There is no automatic annual price increase. We already know that the $2,340 deductible will increase each year. The last thing you want is for the premium to increase each year as well. Then you have two components of your health care compounding against you. That can be devastating over the decades that you may be on Medicare. Now, I do have a few exceptions to this rule. One of them is certain parts of California. Not all of California, but certain parts have very high Medicare supplement plan prices, combined with some of the highest annual price increases in the country. Now, that's just one exception, but over the long run, what we've found is people can be priced out of a Plan G or Plan N because they're starting off with high prices and then have very high compounding of prices close to double digit. In those cases, in that exception, even though it's an attained age state, you'll find that the Medicare supplement high deductible plan may be a good option. There are other exceptions too. Just reach out to us and we can go over what's right for you. So there you have it. You now have enough information to understand and evaluate a high deductible Medicare supplement, Plan G or Plan F high deductible. If you would like us to provide you quotes or recommendations, please reach out to us by telephone or by email. Go to our website, use the Contact Us section or the Quote Request section. Our services are free to you, the consumer. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.